The public health guidelines about the way we do them remains the same. If we are to avoid accelerating numbers, we need to be cautious and adhere to the basics. Do not assemble in groups. When away from home, wear a mask. When with people other than those we live with, maintain a physical distance of 2 meters. Wash your hands often. And if you feel ill, stay at home. Don't go to work or school. Seek medical advice and get tested. As a community, we have made good progress. Let's keep our guard up and our cases down. Thank you.
Thank you very much, Andy. Okay, so now we will turn it over to Dr. Salvatierra to provide us with the latest data regarding the COVID-19 situation. Go ahead, Dr. Salvatierra.
Thank you, Brittany. So I'll start with the situational update. As of 4:30 p.m. yesterday, there are currently 18 active cases, 13 fewer than last Friday. It is very encouraging to see more cases resolving and fewer new cases being reported. In total, we've reported 559 cases since the pandemic began, and my team is currently following 61 high-risk contacts. The number of local deaths from COVID-19 remains at 9. Next slide, please. This bar graph shows our weekly totals, and they are continuing to decline. Last week's, you'll see that from last week, we have declined to 13 new cases as compared to 31 cases for the week of February 4th. Next slide is on exposures, and here again, you'll see some changes after many weeks of consistent data. The overall proportion of our cases exposed to high-risk contacts has increased again. You see that big green bar at the top there on the right. That's now showing that 73% of our cases are linked to high-risk contacts, up from 68%. The overall rate of community spread has decreased. You'll see the yellow bar. It's now down to 18% in contrast to 22.5% just a few weeks ago. And the last 4 weeks certainly reflect that this trend of more exposures being from a contact to a case, 110 cases in total, compared to the much lower number of cases, only 12, where we could not find an epidemiological link. Our next slide gives you our testing data. We last reported a week ago, and since then another 450 residents have been tested. This brings our total to approximately 42,000 of our residents, or 28% of local residents having been tested at least once. Our next slide gives you our outbreak data. And we have currently 2 active outbreaks continuing, one at PRHC and the other at Peterborough Retirement Home. Our staff continue to support both facilities in managing these outbreaks. And then finally, our last slide with our data showing our cumulative case incidence rate per 100,000. Our rate is at 378 cases since the pandemic began, which is about 1/5 of the cumulative provincial rate of 1,872. You'll note that the colored coding on this map reflects the legend on the left and is not the same as the provincial color-coded framework that is being reintroduced with the end of the stay-at-home orders. I'll touch more on this later. But what's really exciting is that the drop in our weekly case incidence rate, shown here as 9 cases per 100,000, and that is a significant change from last week when it was 22 cases per 100,000. So lots of good news all around with our data. I know our community is very interested in how the vaccine rollout is proceeding, so I'd like to share with you some early data on the uptake of our COVID-19 vaccines at our local long-term care homes. As of February 7th, we had completed the first dose in 5 local long-term care homes. And here you can see the strong demand for vaccine in each of these homes. Each home had more than 90% of eligible residents received their first dose of vaccine. And I'm happy to say that yesterday at St. Joseph Fleming, we saw again about 94% uptake of the vaccine, with 186 residents and another 10 healthcare workers being immunized to ensure that we had no doses wasted. Today, our immunizers are at Centennial Place and Extendicare Peterborough, where we expect to complete the first dose in all 8 long-term care home facilities, 1 day ahead of our February 10th provincial deadline. Plans are underway to coordinate the rollout of vaccine in our local retirement homes as soon as we get the green light from the province, with safety inspections taking place this week. We continue to prepare for mass immunization clinics in the spring with all of our community partners, and it's been quite remarkable to see the strong interest from local residents and healthcare workers in volunteering to support these clinics. I look forward to keeping everyone updated as details firm up. Yesterday, Premier Ford announced that the stay-at-home orders would end and the province will gradually transition each region from shutdown measures to a revised and strengthened COVID-19 response framework. The Peterborough area is one of the 28 regions where the current stay-at-home order will remain in place until Tuesday, February 16th. With the threat of the variants of concern now circulating in parts of Ontario, we all need to ensure that the reopening does not become the beginning of a third wave. We have had almost a year now to hone our public health and workplace safety measures, including staying at home as much as possible, avoiding social gatherings, minimizing our travel between areas with different rules, and sticking to our household contacts only. February 16th will be showtime. It will be up to all of us to be diligent about washing our hands, about carrying sanitizer with us, staying at least 2 meters away, and wearing masks both indoors and outdoors when indicated. We still have months to go before we are able to count on the COVID vaccine to protect us. So to provide us with an update on our enforcement activities, I'd like to invite our Manager of Environmental Health, Julie Ingram, to share a few remarks. So over to you, Julie, please.
Great, thank you very much, Dr. Salvatierra. So it is an exciting time that gradual reopening is being considered right now, but as mentioned, we are status quo and we are still under the stay-at-home order and shutdown measures until at least February 16th. Our indicators over the last 2 weeks are currently being reviewed, and we should know more by the end of the week about what color zone we will be opening up to in the COVID-19 response framework. So I do urge everybody to keep an eye on our website for those updates, and we will communicate more as we know. Our team is currently reaching out to all of the various sectors that we've connected with to provide some more information, and we're actively working on updating our website. So that's going to be the best, most reliable source of information for you as we're going through this. But what I would urge all businesses and organizations to do in the meantime over the next week while you're waiting is to focus on your COVID-19 safety plans and your capacity limits for your premises. There are new requirements. Businesses that didn't previously have to have a safety plan will now need to do so, as well as calculate capacities and post capacities at entries. This is one of the most common areas of non-compliance that we're seeing. In fact, with our grocery and our big box splits that we've done over the last week and a half, there were areas of non-compliance with the COVID-19 safety plan. So this is something that everybody can be proactively doing now. If you go to our website and our information, ministry has developed a lot of good guidance documents and checklists for the safety plan, and it will walk you through everything. So please take some time to start working on your COVID-19 safety plans. They have to be made available to anybody who asks for it, and it also has to be posted in a conspicuous place, both for your staff and for members of the public to see. So in addition to the non-compliance with the safety plan, some other areas that we want to highlight for businesses is to make sure that you have approved disinfectants for use. Disinfectants need to be used on the high-touch surfaces, so things like light switches and door handles and shopping carts. Approved disinfectants need to have a drug identification number, and it does have to be a disinfectant, not just a sanitizer. So there's a heightened expectation for those high-touch surfaces. So just be aware of that, making sure that you have COVID-19 signage posted at your entry so that any customers coming in know to exclude themselves if they are experiencing any symptoms, and that's something everybody should be following. If you're not well, stay at home, and then posting and monitoring those capacity limits. Last week, our inspection team conducted 27 COVID-19 investigations. We did lay one charge under the Reopening Ontario Act, and we issued 6 formal warnings to businesses for non-compliance. Those warnings ranged from businesses operating that shouldn't be operating to lack of adherence to public health measures. I'm happy to announce that more support is coming to the area for inspection. We will be having a multi-ministry task force campaign running from February 17th to February 20th. There's going to be numerous provincial offences officers conducting COVID-19 compliance inspections throughout the city and the county of Peterborough. And we're going to have a targeted focus on the retail sector. This is going to be timely as it's going to be the same week that businesses will be reopening. So primarily we're going to be looking at the liquor and beer stores, big box grocery stores, supermarkets, dollar stores and discount stores, pharmacies, bulk stores and other specialty food stores, as well as convenience stores and gas stations. As we progress through reopening, that list is subject to change, and the results from the campaign will be shared when they're available. So there will be many provincial offences officers on the ground on time with the reopening. So looking forward to that, and thank you.
Thank you very much, Julie. Okay, so thank you also to Dr. Salvaterra. And now we have an opportunity to hear from our elected officials. So I will we'll start with MPP Smith, considering he does need to dash off, and we're grateful to have you as part of our media briefing today. So please go ahead, MPP Smith.
Thanks, Brittany. I really appreciate that. As has already been said, we are starting the reopening process, and our area will start to reopen on February the 16th. We've made some tremendous progress, but we're not out of the woods yet. There's a light at the end of the tunnel. This is not meant to be going straight back to business as usual. We still have to be diligent. We still have to make sure that we're moving forward in the right way. And kind of the analogy I'd like to make on it is, if you've ever had an injury, you can't, as soon as you take the cast off, do what you used to be able to do just before you had the cast put on. We have to take a little bit of time as we move forward with it. Businesses will be able to reopen with a limited capacity to start. And as we move through this and show that we can get through it without creating more infections, we'll be able to do more. There's a little bit of confusion I'd like to clear up as well. After yesterday's announcement and some of the comments that were in the media, we received a lot of phone calls and emails in my office about supports for businesses. Absolutely 100%. There are grants available for businesses. If you are a small business that has less than 100 employees and you saw a 20% reduction in your revenue, you might qualify for a $10,000 to $20,000 grant. It is one of the easiest processes you will ever go through for a government grant. Most businesses are able to complete the entire application in less than 3 minutes. If you have any problems at all, though, doing it, please do not hesitate to reach out to my office. The number is 705-742-3777. We've already walked through more than 100 applications with different businesses to make sure that they can get their information in properly and qualify for those grants. In Ontario, we have now given out more than 40,000 of these grants to small businesses. The money is actually in their bank account. It takes about a week and a half to process it and get it. It's one of the fastest processes to get grant money. So please, if you're a small business, if you've struggled through this, if you need that little bit of help so that you can reopen safely in a week and a half, do not be afraid to apply for that grant. And if you have any questions, please reach out to my office. Thank you.
Thank you, MPP Smith. Okay, so I see that Chief Laurie Carr has been able to join us. So if you have any comments, Chief Carr, please go ahead, or would you just like to be available for questions?
Hi, Brittany. No, I'll just be available for questions. I think that Mayor Mitchell and MPP Smith, they really highlighted the necessary areas of remaining vigilant. So I will just leave it there and be available.
Thank you so much. Okay, so we also have Mary Monsef, our MP, on the line, and I look forward to hearing your updates, MP Monsef, so please go ahead.
Thank you so much, Brittany. Hello, everybody. Bonjour, Anin. Salam alaikum. I join you from my home in Peterborough, and in a few minutes, I'll be switching devices and getting on to a conversation with every minister in every province and territory responsible for early learning and childcare. We are making small steps forward possible by working together. Today, for the purpose of this announcement, for this presser, I'd like to focus on vaccine rollout, on testing, a travel update, taxes, and then hand it back over to you, Brittany. On vaccines, I want to thank Dr. Salvatierra. I want to thank you, your board chair, and the entire team at Peterborough Public Health, every single one of our frontline workers who continue to do outstanding work. All long-term care homes, all long-term care homes in Peterborough have received their first shot. That is big news, and it's thanks to so many. To receive your first vaccine, especially knowing that our elders are most vulnerable to this virus, I know this brings a sigh of relief to many families, and I know everyone is anxious to know when theirs will take place, myself included. We remain on track to receive 6 million doses of the 2 approved vaccines in March. That's 4 million from Pfizer and 2 million from Moderna. In the coming weeks and months, we're going to get even more doses faster. Next week, we're scheduled to ramp up vaccine deliveries with more than 130,000 here in Ontario, and then another 150,000 the following week. These vaccines are safe, they're effective, and they're going to save lives. And I can assure you that top experts at Health Canada are working around the clock to make sure that any new approved vaccines are also safe and effective. We're going to work tirelessly to ensure every Canadian who wants a vaccine is able to get one by September. On testing, we know rapid testing is an important tool in our toolkit to keep this virus under control. People get screened, they get quick results, and we get to stop the spread. Our government has sent 19.6 million rapid tests to provinces and territories, with more on the way. We all want to see these numbers go down, and testing can help with that. And of course, contact tracing and vaccines are additional essential tools in the months ahead to allow us to get through the pandemic as quickly as possible. Given the challenges around variants and concerns raised, we're using even more tools to get through this crisis together. This means starting on February 15th, land borders will require a 72-hour PCR test for travelers, just like international air travelers. I will have more information about that soon. As we approach tax season, it's important to file your taxes so that you can continue to get benefits like the Canada Child Benefit, the Climate Action Incentive, which comes from pricing pollution right into your bank account, and other federal benefits. Last year, 8 million people received the CERB so that they could pay for rent and groceries. We're providing 1 year without interest on tax debt. If you received the CERB and you made up to $75,000 in taxable income, you will not have to pay interest on the tax debt until April of the following year. People who receive CERB based on their gross income instead of their net income won't have to repay if they meet other eligibility requirements. My team and I are here to help you, and our entire government's priority is to make sure that you and your family are able to get on your feet and help with limiting the spread and getting our economy and our communities back to a new normal when it is time. My provincial colleagues spoke about the lifting of the stay-at-home order. While this is a positive sign, it does not come without risks, and it is up to every single one of us to double down on measures like wearing our masks, distancing, washing our hands, and limiting our outings. We have made a lot of hard-won gains, and we continue to mourn the losses. So we can't let our guard down, and we have to do the public safety measures that much better from here on. Thank you, Brittany.
Thank you very much, Miriam. Great that you could join us from Peterborough today. I see that MPP David Piccini has been able to join us. Welcome back, MPP Piccini. Did you have any comments that you would like to share with the group today, or would you just like to be available for questions? Oh, maybe he dashed off. Sorry, I did see him on there. Okay, looks like he has to move on. So let's hear from our municipal representatives, and we'll start with County Warden Jones. So go ahead, County Warden Jones.
Okay, I'm hoping you can hear me okay, and thank you again for including the county. I wanted to do just a bit of a shout out today at our paramedics, who are doing a Herculean job out there. And they, of course, always have ever since COVID started. But there is some elements of COVID fatigue out there, and nobody but our paramedics seems to see it as much as they do. They continue to perform remarkably well. You don't hear a complaint from them. And sometimes you get patients who don't have any patients and perhaps get a little frustrated when our paramedics have to put on their emergency protective equipment. And, you know, that can be an issue sometimes. So we just want everyone to be aware that they're doing the very best they can do. They need to protect themselves as well. So I've got a big salute to our paramedics who are with us each and every day and doing a lot of great work. And, you know, with golf season just around the corner, I've come up with a new acronym that maybe we can all use, and that's PUT. Patience, understanding, and trust. I think if we all live by those words, we can putt together. Thanks, everybody. Thank you for everything that everyone's doing.
Thank you, Warden Jones, and for putting it so succinctly. Okay, so now we will invite Mayor Diane Therrien from the City of Peterborough. Do you have any comments for us today, or would you just like to be available for questions?
Just quickly, I think it's been covered by the previous speakers, but very much looking forward to the gradual reopening of our small businesses, which is really important. And the city's continuing to work with public health on enforcement and monitoring, particularly of some of the big box stores, which we've been hearing concerns about. So we'll be continuing to do that and working together to reopen in a safe way. And again, just reiterating the comments from my colleagues about the need to remain vigilant because we're not out of this yet. So I'll leave it at that. Thank you very much.
Thank you very much, Mayor Therrien. Great to have you with us today. Okay, so now it's the opportunity for our reporters on the line to ask some questions of Dr. Salvaterra. We'll start with Taylor Clydesdale from Peterborough This Week and My Kawartha. And if you have questions for Dr. Salvaterra, please go right ahead.
Thank you. I do. Actually, I have questions for Dr. Salvatierra as well as Julie Ingram if she's still on the call.
Yes.
Okay. All right. Maybe I'll start with Julie then. Maybe we can just go into, she had mentioned that a charge had been laid. I'm just wondering if there's any specifics or more detail that can be elaborated on, such as what the charge was for and whether it was a grocery store, a big box store, kind of just elaborate on that point if you can.
Sure. Okay. Yeah, I can share that a charge was laid under the Reopening Ontario Act, and it was for a retail store. I won't specify what type, but it was for a retail store, and it was associated with non-compliance of masking requirements by a person responsible for a business or organization. And that's what I'll leave that at.
Okay. Other than that, how did the blitz of big box and grocery stores go? What were your observations in your observations in that, and what was found through these other warnings that were issued?
Yeah, great question. So overall, the grocery and the big box store blitz went well. We did 30 inspections in about a week and a half of those stores. They're lengthy inspections. They're an hour or longer, sometimes 2.5 hours. We would give a thorough report to the operator outlining our recommendations. The most common areas of non-compliance that we saw was some of the signage for passive screening of customers wasn't posted when it should have been. And then really some of the chemicals that were being used, we got really in detail with whether sanitizers were being used appropriately or if disinfectants were being used appropriately, and just making sure that the appropriate chemicals were used in the appropriate situation, as well as safety plans. I can't urge that enough, that it is a requirement. We are looking for them. They have to be posted. They have to be presented as well when requested. So I would say those were the three most common violations that we did see. But overall, things were quite good in most of the stores, and store operators are really being diligent. They were also very receptive to any feedback that our inspectors had, so that was really nice to see as well. As for the other warnings that were issued, again, it's for non-compliance with public health measures for the most part, and that's where, you know, that message is about staying vigilant has been shared over and over again, and that's what we urge as well. So a combination of that, as well as businesses operating that aren't permitted to operate right now.
You mentioned signs posted about capacity. Were there issues with stores being over capacity, or was it just with the signage of capacity limits?
Yeah, good question. It was actually only with the signage of capacity limits. We did not inspect a single store that was either nearing or exceeding capacity. There are some improvements to be made for monitoring capacity, but none of the stores inspected at the time of inspection were over capacity.
Okay, that's all very good to know. Thank you. I think that's all the questions that I had for you, Julie. Thank you so much.
You're welcome. Thanks.
If I can just roll on over to Dr. Salvatierra then for a couple of questions. Just Dr. Salvatierra, if I may, how is the rollout of retirement homes expected to go? Is it going to be kind of in the same pattern that it happened with long-term care homes?
Well, it'll depend on what the provincial directive is. Right now, we cannot do retirement homes because of the vaccine scarcity and the prioritization for long-term care residents. As soon as we get the green light for retirement homes, we will begin them. We're making all the preparations. I don't know yet whether we will be allowed just to do residents or whether we can do all of the staff while we're there. So we're just awaiting more details and more vaccine.
That was my next question too, was do we have the vaccines yet for that yet? So I'm seeing that we don't.
No, not yet. We are expecting to receive some Pfizer vaccine before the end of the month. And that is why we're going ahead with plans, because we do expect to use that vaccine up quickly when it does arrive here.
Okay. Just in terms of lockdown and the easing of restrictions, I know it was mentioned a couple of times that we don't know what color we're going to be. Do you have an idea as to what what color we might come out in the provincial framework as? I know you mentioned, I think we might come out in the yellow zone a little while ago, but that was a couple of weeks ago. I think you mentioned that.
That's right. It was last week, actually. We were, at least as far as our indicators were showing, we were in the yellow. It's really a composite picture that is required to make that decision. The province looks at our indicators as far as our outbreak. They also look at capacity for both public health and for the hospital. And they also look at what's happening with outbreaks. And so I think the most promising sign is that our incidence rate has dropped to 9 for this week. We need to be below 10 if we want to be in green. I don't know yet what our other indicators are, how well they're doing. I'll get a better sense by tomorrow when we run the numbers ourselves. And then, as you know, we have 2 outbreaks. If they continue to be well controlled, and if we declare them over, again, that would be more reason why green would be the appropriate zone for us to emerge in. So I think the short answer to your question, Taylor, is that we're trending towards green, and I'm hopeful that when we emerge, we will be in green, but that it'll really depend on what happens between now and next week.
All right, I think that's it for me for questions. Thank you so much to Julie Ingram and Dr. Salvatierra. Appreciate it.
Thank you, Taylor. Okay, so Paul Rellinger from Kawartha Now, please go ahead and ask your questions.
Thanks so much, Brittany. A couple of questions for Dr. Salvatierra and one for Julie, if I may. Dr. Salvatierra, I just wanted to clarify. So 3 health units yesterday were moved into the framework. So what you're saying basically, and I just want to make sure I got it clear, is that if we didn't have outbreaks as of yesterday, if our case numbers were, I take it, substantially lower than what they are right now, that would have been taken into consideration and we possibly could have been moved yesterday.
If our indicators had been better last week when the data was pulled by the province and looked at, those 3 public health units, they had conversations with the Chief Medical Officer of Health at the end of last week. So they were looking pretty good then. We were still in yellow last week, and as you recall, Paul, we had 3 or 4 outbreaks at the time. So it really, this week, things are looking a lot better for Peterborough this week. So if we keep this up, as I said earlier to Taylor, I'm hopeful that we will emerge at the green zone.
Okay, thank you for clarifying that. Regarding the outbreaks, the 2 that we have going on right now, I think my data is correct, but the PRHC one was declared January 21st, and that's a few weeks now. So, like, I just want to get a sense of what would have to happen or what needs to be necessitated to declare that resolved.
Well, we need to have enough time elapsed between the last positive case and to have a sense that there are no further cases incubating. So for both the PRHC and for the retirement home, they continue to have to retest their residents, their patients, their staff every few days in order to find asymptomatic asymptomatic cases, and then they have to have no cases for a number of days before we can declare them over. I know, for example, with the regional hospitals, PRHC and with Peterborough Retirement, they are continuing. They're still waiting on results of their last round of testing. So I haven't heard yet whether they have any new cases this week or not.
Okay, and if I could ask, if those outbreaks aren't declared over by the end of the week, how much of a factor will they be in terms of next week? Because you mentioned outbreaks as one of the indicators. Yeah, so I'm just trying to get a sense that it doesn't sound like they're going to be over this week, and I'm just wondering what that means for next week.
Well, they may not be over, but if they're stable and not growing exponentially, then that is also a good sign. All of these none of the factors are weighted in the decision making, so I can't say that the number of outbreaks is going to have a greater weight than our weekly incidence rate. It really is a composite, and then also local medical officer of health is consulted so that we have some of that context that we can bring to that conversation, and then the decision is made by cabinet.
Okay, thank you. And just one more thing. You mentioned the retirement homes and the rollout of the next vaccination. Probably a totally unfair question, although you might know. Do you know how many retirement homes you'd be looking at, or how many residents? I'm getting you to do my homework for me again.
I don't have that information at the tip of my fingers, Paul, but I would expect that, we do have that information. And keep in mind that it will be not only retirement homes, but it will also hopefully be other congregate settings where seniors live. So unlicensed retirement homes or apartments where there is congregate dining. So it'll be a larger group, I hope, than just the licensed retirement homes.
Okay, thank you, Dr. Salvatierra. If I could, one question for Julie Ingram. Julie, I'm curious. This health unit has been pretty good in terms of giving people warnings and educating when there's been non-compliance. Now there's been a charge. So I guess what I'm trying to get a handle on, was this a business, if you can say, was this a business that was warned and ignored it, and that's what brought the charge? Because like I said, the record of the health unit has been pretty much educate, comply, ask people to do the right things, which has worked for the most part. But here we have a case where there's actually been a charge. So I'm thinking, and perhaps wrongly, that there may have been a warning prior for this business?
I'm not going to specify specifically for the business if there was a warning, but what we are using as an enforcement tool is progressive enforcement. So you're right. We take the education approach, we take the warning approach. But when it comes to a person that's responsible for a business or organization, they have an obligation to be aware of the rules and requirements. And masking is no secret at this point that there is an obligation to have masking policies in place and comply, you yourself as a business owner, as well as having your staff comply with masking requirements. So in this case, it was a very obvious just disregard for the regulation, which is what prompted the charge in this case.
Okay, thanks so much, Julie. That clears it up a lot. Thank you, Brittany. That's all the questions I have.
Okay, great. Thanks so much, Paul. So I see Trent Radio on the line. I think that's Rob. Did you have any questions for our speakers today?
Hi, Brittany. No, thanks. Not at the moment. Paul and Tyler got all of mine.
Oh, okay, great. So let's move on to Jessica Nisnik, who's here with us from Global. Do you have questions today, Jessica?
No, not at all. We're doing the last two today, Jessica. We will complete all 8 of our long-term care homes by the end of the day today. No one's jumping ahead to anything right now. We've been told to hold firm on our doses. The only other group we can do right now are the ALC patients at the hospital who are imminently awaiting transfer into long-term care homes. So there's a small group of patients that are currently at PRHC that are waiting admission, and those are the only other people that we are allowed to immunize right now.
Okay, thank you very much, Jessica. And just to clarify, we've completed the first dose in those 8 homes, so there's still a second dose to go. Okay, well, that actually brings us to the end of our briefing. Although Matt Latour is on the line, he's indicated that he's just recording this and he's not available for any questions. So, thank you very much. Appreciate everyone's time. Thank you to our elected officials for their comments and words of wisdom, and we will see you back here on Friday for our next update. Thank you. Bye-bye.
Thanks, Brittany.
Bye.
Bye. Thanks, Brittany.